not there. We've been talking to them, not just in New York, all across the country. These nurses, these doctors are calling us. They're very scared. Some are even sending us videos where they are crying because they're having to make this anxious decision about going to work, knowing they could potentially be exposed without proper equipment, and then risking coming back to their family. We talked to Judy Sheridan Gonzalez. She's an ER nurse in New York. She's also head of the New York State Nurses Association, and she told us this.
We are terrified. Everybody is terrified. We feel an obligation to take care of our patients. Everybody does. But we don't want to become sick, and we also don't want to become carriers, nor do we want to be so disabled that we can't care for people.
A nurse in Ohio told us she just quit her hospital because she couldn't take the risk of knowing she didn't have the proper protective equipment and exposing herself to COVID-19 and then coming home night after night to her children. Brianna, it is a real struggle for these heroic workers who are out there doing this battle, obviously without the protection that they need.
Yeah, this is they are serving this country. It is admirable and simultaneously unacceptable. Drew Griffin, thank you so much. I want to talk to Richard Pollack now. He's the CEO of the American Hospital Association. Welcome. Thank you so much for being with us.
Thank you for having me.
So your group, along with the American Nurses Association and the AMA, they all say that a minimum of $100 billion was needed in assistance. The stimulus proposal for hospitals is $130 billion. Some officials are warning, though, that coronavirus has not yet even peaked in the U.S. Is $130 billion enough as you see it?
It's an important first step that will give us the resources that are very much needed in terms of getting the supplies, the personal protective equipment that we need to provide to our healthcare caregivers that are on the front lines, the doctors, the nurses, and other workers that are the true heroes in this battle. It'll be helpful in that regard. There's also assistance in there to help us build surge capacity as well, and to help us with cash flow, because we've shut down all other operations, have nothing coming in, and we have a lot of expenses going out. So we're going to need that type of funding. Now, I want to praise the leadership of Senator McConnell and Senator Schumer. So important first step, Brianna, but it's not going to be enough in the long run.
What happens for hospital workers who end up dying from coronavirus and they did not have the appropriate safety gear?
Well, our focus right now is getting them the protective gear. That is our number one priority. If we don't have the gear and we don't get that to them, then the whole system will collapse. Of course, we care about protecting their lives. They are the frontline warriors in this battle, and they need to be protected. Right now, we're working with all sorts of companies to produce more of that protective equipment, get more of it into the supply line. We've asked the president to use the Defense Production Act to ensure that there will be more. We need to press every lever we conceivably can to make sure that those healthcare heroes get the equipment that they need.
But some of them don't have it and they're already putting themselves at risk. Are you confident that they're going to be taken care of? I mean, I think of, for instance, folks in the military, when they give their lives, and you know, we've seen issues in the past where they didn't have the proper equipment as well. When they give their lives, their families are taken care of. Are you confident that the families of these frontline medical workers are going to be taken care of in some way?
We've got to do everything we can right now to make sure that we don't even get to that point. That's the objective. That's why we have to get them the equipment. We have to get the supplies going from the strategic stockpiles. We have to ensure that there's more product being put into the pipeline. We don't want to get to that point.
Can I ask you though, seriously, aren't you already to that point? I mean, sure, you can try to catch up and make sure that it doesn't spread that far, but you're already seeing frontline workers come down with this, and they're reusing masks, they're not using the masks they should use. I mean, aren't you already to this point?
Well, there have been, very unfortunately, some healthcare workers that have gotten infected. And that is something that obviously is troublesome. But again, the focus now is to protect them as much as we possibly can. Again, the system collapses without them being healthy and without them having the protective gear.
Okay, I want to know if you think the U.S. is going to have enough ventilators by next week.
There's a gap. It all depends upon where it's needed. New York obviously is struggling to get as many as they can because they're now a hot spot. And we know that we need more. That's why, again, we think that the president ought to use the Defense Production Act to order more of them. We ought to unleash them from the strategic stockpiles. We ought to make sure that every conceivable avenue is used to make sure that those heavily impacted areas have all the equipment they need. This is an unprecedented situation, and we're focused intensely on making sure we get as much as we can to the front lines.
Right now, as you know, roughly half of the country is under either what's a full stay-at-home order, or maybe it's a partial, or something that might actually effectively be a stay-at-home order. The governor of New York says the numbers are suggesting that social distancing is working in his state. Are you seeing any evidence that it's helping in terms of stopping the spread?
You know, our view is we have to follow the science and we have to follow what the local public health authorities are suggesting. And in that vein, by the way, the American Medical Association, the American Hospital Association, the American Nurses Association has written an open letter to the American public saying we've got to stop the spread, people should stay at home. And when we talk to our frontline healthcare workers, their message is that they are there for you. And their ask to the American public is that everyone should stay at home for them. And that's why we need to follow the guidelines. We need to make sure that people do, in fact, stay at home except for essential types of services. And we believe that that is the best approach right now. And we have to make sure that we follow those guidelines and instructions.
You've heard the president wants to reopen the country really to business by Easter. Some officials are working on a rolling plan that would ease restrictions on different people at different times, maybe in different places. What would that mean for hospitals and their ability to stay below capacity for treating people?
Well, you know, I know the president made some suggestion that he hoped that we can get back to some semblance of being normal by Easter. That was a hope. We all hope we can be back in a better place by Easter. But we have to be realistic about it. We have to evaluate it on an ongoing basis, and we have to follow the science and the data and do what the experts tell us to do.
So, it sounds like you're saying that's unrealistic.
What I'm saying is we have to follow the science, and we have to follow the data, and we have to follow what the experts tell us to do. We have to evaluate it on an ongoing basis. It's a hope. It's something that you can be optimistic about, but from everything I hear, it's probably going to be longer than that.
Okay. All right, that's what we're hearing too from the experts we've been having on. Richard Pollack, thank you so much. We really appreciate you joining us.
Thank you.